So I am going to do a brief intro. I work in Taunton in Somerset, and there's lots of fantastic things being said about some of your trusts, and I can't see anyone else from my trust there, so I'm just going to do a shout out to the team down there. They are also doing fantastic work, and I couldn't be prouder of the people working in quality improvement, working in digital, working on the front lines throughout from board to ward. And a bit of a plug to the blue plaque. So Roy and Terry, before COVID hit in vengeance, were very generous in awarding Somerset a fab blue plaque for a culture of improvement. And this is something that you guys can all go for yourselves. So if you're doing brilliant work, please shout about it. Tell these guys, I'm more than happy to help you do an application. And there's Gloucester have got one too. There's a few trusts now who've got them, but it's something that if you want some recognition of the amazing improvement work that you're doing, and it doesn't need to be quality improvement, it's just fantastic. Trying new things, sharing new things, getting engaged in that culture change that we've been talking about, then please contact Terry, Roy, myself, any of us, and we'd be more than happy to help you through that process. So today I'm here with Jason, my colleague from Bath, and he's here. We've never actually met, but he's one of my fabulous friends, and my fabulous friends are librarians. Okay, so I'm going to be doing a lot of shouting out today to the library and knowledge services teams that you all have available to you. They are an untapped resource, or at least if you're tapping into them, you're one of the lucky ones, because lots of your colleagues don't necessarily know quite how incredible they can be. Roy had 5 messages, I have 3. One of them is to go one step further than your data-based piece, and I want to say be intelligent improvers. So use the data, but also use the knowledge from those around you. That means going to libraries, it means looking out there, it means searching beyond your own organisation to be really connected and find out what other people are doing. The second thing is around, and this is the reason I do what I do. So I work trying to connect people with knowledge and evidence, okay? I started in Somerset and I've been working increasingly across the board just with anyone who will listen. So the reason for doing the piece of work was that feeling I had, and if we were all in one room, I'd be playing the song Another One Bites the Dust right now. Because you know when somebody has exactly the same idea, and it very often happens to me around QI training, but we all know projects like that, beds, outpatients, A&E, you know, every single one of us has probably a handful, if not more, of those projects that it just comes up time and time again. And every time I see one of those projects, and I'm sure my library, we can all talk about it, we all know, it's like in my head I've got Another One Bites the Dust, another hours and hours of meetings, of searching, of talking about the same things that we've all been talking about day in, day out for years, as people who've been in the same jobs as us for years before, talking about the same stuff. There's reports on a shelf, there's other organisations tackling exactly the same thing. So my second challenge to you all and request is, please, when you have that feeling that it's like that Another One Bites the Dust moment, stop, take a step back and ask yourself, who could you bring into this conversation? What evidence, what knowledge, what resources, what documents, what people could help you stop doing that duplication? The third piece that I wanted to talk about was pay it forward. And it's very easy for us to just stay on our hamster wheel of what we're doing. We are all incredibly time pressurised. We've got loads of stuff going on. We're so focused on trying to do a brilliant job for the patients in front of us, for the teams in front of us. But please, 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 you are a fount of knowledge. Each and every person in the NHS has a tremendous amount of expertise, knowledge and experience. You might not always appreciate it, but trust me, those who don't have it would love to have even a tiny window into some of that experience that you bring with you. Even if you're new to the NHS, it really doesn't matter. You're bringing something special to the team effort. But that team effort is not the team just sitting in front of you on the table there and then. There's a huge team out there who could learn from your experience and what you've done and what you're bringing to the table. Nobody asks you to share liberally with everyone all across the country and anyone who will listen. Nobody pays you specifically to go and share an article on Fab or make a pledge or write an article or take a poster into a presentation. But please pay it forward. Be that person who sets off that virtuous circle of sharing, of helping, of supporting, of connecting. Fab is full of brilliant people doing that each and every day, but that's just us, and we can only do what we can do. But each and every one of you listening to this, your teams, your people, you're setting examples. You can set off that virtuous circle. So please, that's my 3 things. It's simply be an intelligent improver, and we'll talk to Jason in a second about some of the ways that our library teams, they're library and knowledge specialists, okay? They are treasure hunters for gold dust that you didn't know could help you. They can help with the most crazy of challenges, and I don't think there's any challenge you wouldn't tackle.
No, we love the hardest challenges.
So it doesn't need to be clinical. You know, we've all seen during COVID how important it is to look for the evidence, okay? We know that. You wouldn't consider doing something to a patient without finding out what other people have done. You wouldn't put somebody on a drug. You wouldn't go down the route of saying, should we try this, should we try that? We have to do that when it comes to quality improvement. And there's some guys here across the country who do this as their bread and butter and can help us. Some of us are amazing at doing it ourselves. I'm not one of them, I'm learning. But all of us have a resource available to us. And over the coming months, as we move to this new crazy structure of ICS and another reorganisation, we've also all got a hell of a lot to learn. So you might know your pocket of the NHS, but I'd be very surprised if you all know all about social care and all about the charity sector and all about how the councils operate and the terminology that they use and how the dynamics work and what they're interested in and the politics. There's just so much we don't know. There's so much that they're trying to learn about us as well. And be an intelligent improver, connecting with those people around you. Use the resources available and be a role model and pay it forward. So that's my messages to you today. I'm going to pass over to Jason, who I've given the challenge to sell, to essentially sell. Librarians tend to be quite modest, and they're just incredible at what they do. So I talk a lot about how incredible they are. And I could have been in any trust today and have an equally incredible person. Jason is here because Gina has got fabulous things to say about him because of the way that he has helped Gina and her teams here. I could say the same in Taunton, I could say the same in Gloucester, I could say the same in Dorset, I could say the same in Leeds. I could look at any one of your trusts and find incredible people saying how incredible the support is that they've got from their library services in real time. So please listen to what Jason's got to say and go and find out what's available to you if you don't already know. And if you have had brilliant experiences with your own teams, please shout about them either on Fab or pop some comments in the comments box and just shout out to those brilliant people in the library services who don't often get a thank you, to just say how they've helped you, because it might just inspire one other person to ask their teams to help too. So that's enough from me, and over to you, Jason.
That's brilliant, thank you. I'm actually just going to move across slightly because I'm out of screen, out of the picture here. It feels very strange, and thank you very much for the welcome. Thank you to Gina and everyone involved in Fab. I am not your typical librarian. I've been a healthcare librarian for 28 years now, and I'm probably one of the most positive people. And when Andrea and I discussed what we were going to talk about today, she said, "Oh, do you think you could be positive? Do you think you could sell your services?" And I said, absolutely no problem at all. So I'm going to give you just some examples of ways that your local knowledge and library service can support you by finding the evidence, by sourcing documents, and the way that we can help you save time. Okay, so we are there to support your decision making. Okay, I can guarantee that you cannot find a question too difficult for a librarian to be able to answer and to find the most up-to-date evidence for you.
Oh, what a challenge!
No, I've put that challenge out there for 28 years because I'm fairly confident, and no one yet has beaten me. However, occasionally,
unless you know different.
Occasionally people come back and say, but, and I've had to go back and say, but there is no evidence on this topic. And they've gone, but Jason, you promised. Well, I can't magic up evidence. Sometimes there is no answer.
But there are
However,
people.
there are definitely people who can help. So we can support you by saving you time. I'm a really sad individual. I love doing literature searches, and so do my team, and so do all of the knowledge and library services out there across the country. Okay, there was a report written a few years ago, only 2 or 3 years ago now, to highlight the amount of time that we can save you in finding the evidence. It's called The Gift of Time, and Health Education England commissioned it and published it. We reckon, and this is validated data, that health librarians can save the NHS £77 million in the time that we can save by doing a search ourselves. We are experts in using the evidence base and then presenting it in a way that's going to save you time and effort. Okay, so we will go away and perform the search for you, then follow up by sourcing any of the documents. Some services have enough capacity that they're able to synthesize the evidence for you. That's not across the board, however, and we don't actually do it here. I would love us to be able to synthesize the evidence to make things easier, but capacity is an issue. So we just concentrate on being the best in terms of sourcing and finding the evidence and providing links. When you are at the beginning of the project stage, when you're thinking of your question, that's when you need to get your library and knowledge service involved. So get them involved, get us at the table, and we are then able, because we're embedded within the decision-making process, we hear all the other conversations that are taking place. A great example is I'm embedded here at the RUH within our therapies department. So I attend all their meetings, I attend their clinical governance groups. And what that enables me to do is to build up a knowledge so that when I'm doing other things, things appear to me, and I'm horizon scanning all the time. So here at the RUH, you're not going to be able to see it, but we produce regular monthly horizon scanning bulletins, which are great ways for our clinical staff to stay up to date with relevant, up-to-date research and evidence without actually doing any work. And the staff absolutely love it. They're able to put a few comments in their appraisal every year and say, this is how we use evidence to make sure our practice is up to date and is as evidence-based as possible. I've lost my train of thought completely at that point. Andrea, is there anything else you felt you'd like me to mention?
No, I think basically
We were talking earlier where you worked somewhere and you actually worked on the rounds.
Oh yeah, okay, so
this is really interesting.
So knowledge and library services.
Closer because you're out of shot.
Am I still out of shot? I seem to be going further and further out of shot. I do apologise. So a few years ago, I was the embedded clinical librarian within our anaesthetic and intensive care department, and lots of acute trusts have embedded clinical librarians. But what it meant was every day I would do the ward round in intensive care with the clinicians, and any evidence queries or patient care queries that came out of that ward round, I would immediately go away, do a search, source the evidence, and be able to give it to the clinicians in real time. And it was a great way to make sure that our intensive care unit was using the most up-to-date evidence that was possible.
I think, sorry to interrupt you, that's really important. Terry, we went to another hospital, didn't we? Was it
Princess Alexandra Harlow have a similar, where they have librarians that discuss with wards areas that they want to look at and explore, and then they take on a trolley, the library on a trolley with resources and evidence around the clinical area they're wanting to improve or have the evidence to support.
And if there was something in the news like sepsis or something, they put a whole lot of books together in a box and put them on the wards and say, if you want to read about sepsis, these are the books. And I'm sorry to, if you don't mind, I just can't stop asking questions. Somewhere you were saying how students are being pushed by Health Education England now to look at libraries electronically, but most of them actually still want a paper book.
Absolutely. We really struggle in health libraries to engage our users, and obviously a big proportion of our users are healthcare students, to engage using digital resources. And what we find is a lot of our users still want print materials. So now we've moved on in terms of journal articles and journals. Most people can read a journal article online, there's no issue, but we really do find that our users still want print books, and what we are finding is we're having to duplicate electronic access with print access.
I think that's really interesting. And of course, you've got a new book today, Jason. Here it is. So this is, go on.
Yes, this is a certain Roy Lilly's book, dealing with difficult people, that he's donated to my library today, which we will make sure is on our new book stand from later this afternoon, and I'm sure you can all get hold of it from your local
No, Amazon.
Your local healthcare library can borrow a copy from another library.
No, buy a copy. Buy a copy. What's the matter with you?
We're all about sharing resources. We're all about sharing resources.
Well, I have to say, you know, we do look, don't we, all the time. We look at the NHS as sort of being the sole source of everything, electric, digital, IT, you know, this big push. But I have to say that it wasn't until I went with Terry, we went to the Queen Alexander on a fab tour day, and I met, what was the guy's name?
We talk about the Princess Alexandra in Harlow.
Yes, I remember the librarian. There was only a young boy.
I can't
it was
remember
a really
his
lovely
name,
guy.
I'm afraid.
And suddenly I had this whole thing about libraries. You know, I've run a hospital, and I had a hospital with a library in it, and I often wondered what it did. You know, but suddenly they're an amazing source, and they're really up to date.
Absolutely. Can I just share one other example, which is actually on the FAB website as a case study of how we've been involved here at the RUH with patient care. So there was a report went to our board a couple of years ago saying, was there anything that we could do to improve patient experience? So I went away and looked at all of the evidence and thinking, oh, okay, audiobooks possibly. Couldn't find any evidence. However, with the support of our innovation fund here at the RUH, I've been able to purchase, I've now got 25 audiobook players that we loan out to patients with audiobooks on them to help alleviate boredom. And we were the first hospital library in the country to do this. We've put it up on the FAB website, and we know that a number of other hospital libraries are now providing the same type of service. And it's a great way for us to interact and to support patient care, whereas previously we wouldn't have had that opportunity.
Well done.
Roy, can I just say, so it's fantastic. So the work of
just move into shot.
the work of
This
Jason,
is Terry. Here she is.
I'm out of the shot. I don't know. We'll come back in. That Jason has been doing with the libraries and librarians around the country is instrumental, and they share so much on the FAB website. So thank you, Jason. But also a huge shout out to Dr. Andrea Gibbons.
Yes, right.
Andrea, despite working, challenges of COVID, family, has done her PhD, submitted it, and has been awarded her PhD, and it's all around evidence and sharing of evidence. So I just wanted a big shout out.
Yeah.
Congratulations,
Thank you.
Andrea.
Yeah. And if you follow my e-letter, once a month we connect to your QI newsletter,
Yeah.
which is like 2 A4 pages of links to the most
Everything.
amazing stuff.
Absolutely
I mean,
everything.
I don't know where you get it from. You obviously pay a team of researchers.
No, I do it myself.
Take a team of 50 researchers.
Don't you go to the librarian, Andrea?
What?
Don't you go to the librarian and get
I
it
have
for
a
you?
colleague
But
who
it's
did
the-
together
It's the same sort of thing.
as yours.
Yes, there you go.
So Andrea does that for QI, but I know for specific topics, so we do 21 topics here at the RUH: stroke, rehabilitation, dementia, continence, and your local library service can tap in to these bulletins, these ways of helping to keep you up to date.
All we need to know, so I'm not a librarian, I'm just a fan who came into the NHS not knowing how the NHS worked.
So none of us know.
No, none of us. That's very true.
We still don't know.
However, these guys know more than I do, or at least they can find the people who do. And so what we've tried to do, so we've got one pager that's just come out around ICSs.
Yeah.
So we did an ICS one-page summary
Well,
last week.
that's
one
an
page.
interesting topic. Now, what do we think about ICSs? Are ICSs another bloody nuisance that's just going to and make people like Claire have to go and find a new map? Or is it a map maker's delight? Or is it a last best opportunity we're going to have in a lifetime for people to figure out locally how they're going to work together? You know, what
It's
is it?
up to us, isn't it?
What
It's
is
up
it?
to people.
Yeah, and what is your research?
My
on
take.
it? Your take?
I'm not going to pretend that I know what's going to, you know, your crystal ball.
Yeah.
But the
However,
one pager is fantastic
the one
and it's on the
page
website.
Yeah, so
Okay.
everything goes up on Fab. What I would say is each and every one of us can do that pay it forward thing and set off as we intend to.
Claire's got
continue.
rid of her map now, look.
Yeah, she's
so-
getting ready for the next
Yeah.
You're getting ready for the next reorganisation, Claire.
Yeah, no, it's up to us guys to make it work. You know, there's that top-down thing, there's the bottom-up thing, there's the middle management thing. We all need to pull together.
It's a big opportunity. Don't waste it, because